Bell's palsy. So first of all, Bell's palsy is defined as an acute idiopathic unilateral lower motor neuron paralysis of the facial nerve, which leads to weakness or paralysis of all muscles of the facial expression on the affected side, which is basically unilateral, right? So patient will come to you with a chief complaint of deviation of angle of the mouth or dropping of the eyelids. These are the main symptoms of the Bell's palsy. Then I will examine the patient, and while examining, I will see that there is absence of the nasal fold, dry mouth, which is xerostomia. Patient will be unable to froth or produce wrinkle in his forehead, and patient will be unable to whistle because his orbicularis oris muscle doesn't work properly, right? Due to irregular supply of the facial nerve. So I will diagnose this patient as Bell's palsy patient. Now coming towards the management of Bell's palsy. So first of all, you will advise physiotherapy to the patient. Then I will write tab repicot, which is basically steroid, 5 milligram, that is prednisolone, and this is a 15 days course. So for first 3 days you will write 4 tablets in the morning, 4 in the afternoon. Then for the next 3 days, 3 in the morning, 3 in the afternoon. Then for the next 3 days, 3 in the morning and 2 in the afternoon. And for the next 3 days, we'll write 2 in the morning and 1 in the afternoon. And for the last 3 days, we'll write only 1 tablet in the morning, right? Then I will write tab neuromet 500 milligram, which is basically cobalamin. I will write cab rolin Rizek SO, that is omeprazole, which is basically PPI, 20 milligram for 2 times, that is 1 in the morning and 1 in the afternoon, right? I will also write tear plus eye drops 4 times a day, that is for the eye. Thank you. Let's talk about Ramsay syndrome now. So it is a neurological complication caused by the reactivation of the varicella zoster virus. So patient will come with a chief complaint of symptoms of the Bell's palsy, and additionally he will have problem in the ear vesicle, that is ear rashes or audiovestibular issues, right? So we will diagnose it as Ramsay syndrome. To manage such patient, we will add antivirals with the Bell's palsy treatment. Like we will write all the medication of the Bell's palsy, and additionally we will give antivirals. That is tab acylix, which is basically acyclovir, 800 milligram for 7 days. And we will tell the patient to eat the tablet after every 4 hours. That is 6 times a day, right?